Hi, my name is Perlinda Howell, and I'm currently taking Gerontology 6160 Sociology of Aging through Concordia University, Chicago, under Dr. Lydia Manning. This week, we chose a peer-reviewed journal related to the field of aging. I chose an article by Michael D. Laundrie and colleagues entitled Betrayal of Trust, the Impact of COVID-19 Global Pandemic on Older Persons. I believe this article is a great addition to the field of aging, as its content is relevant to the field and sheds much needed light on the potential effects of COVID on older persons. It starts off with an introduction of the known facts of COVID-19. It then goes on to share about its wide global effect, its implications for older adults, the pros and cons of senior isolation measures, medical resource allocations, potential for discrimination, potential for long-term effects of isolation on older adults, and the implications of COVID-19 on healthy aging. It acknowledges that the complete landscape of COVID-19's clinical presentation is emerging, but not yet fully understood. Therefore, it's important that the article sticks more so to the facts rather than providing certain biases. So the major facts that the article touches upon is that according to the WHO Regional Office for Europe, who did a lot of sampling, it mentions that 95% of COVID-19 deaths are among people older than 60 years of age, and further that 50% of all deaths are among people 80 years of age or older. These rates compare to younger age groups in terms of fatality rates, because between 0.3% and 0.4% of fatalities are within the age groups of 30 to 49 years of age. The next group, between ages 50 to 69 years of age, fatality rates are 1% to 3.5%. And then for the age group of those 70 and above, the ranges of fatality range from 12.8% to 20.2%. These are all really good numbers to help kind of understand how our society is taking in COVID and responding to those measures. So we all know that age is a social construct. So in terms of even defining who are older adults, what the term even means, older adults, it's mainly looking at individuals 65 years of age and older. So even the CDC mentions that older adults and people who have severe underlying medical conditions like heart and lung disease seem to be at higher risk for developing more serious complications from COVID-19. So the article suggests that not all older adults will contract COVID-19. Therefore, the article argues that most older people fall into two main groups. The first group, composed of older adults who will acquire the virus and need healthcare treatment throughout the duration of the illness. The second group are those who will not acquire the disease, but spend months in isolation, stress, and uncertainty. Regardless of group, there could be major consequential outcomes for all people, especially those that are older adults during this time. The results of this article mesh well with existing theories on the sociology of aging, as othering is a big topic within the field, especially the othering of people deemed at risk based upon age during this pandemic. Societal presumptions about older adults and the relation between isolation and healthy aging are also things that this article brings about. It supports analysis of our current societal frameworks in terms of community response to the pandemic, life's course perspective of those impacted directly or indirectly from acquiring the virus, and preserving the dignity and rights of older people during this time while keeping in mind the implications of stress on the aging body. The article offers directions for future considerations. It mentions that public health measures to control the pandemic should be accompanied and balanced with supportive programs that will protect older people from physical and mental decline during moments of extreme restrictions. Furthermore, that to avoid betrayal of trust in times of the pandemic, there are two major things that must take course. The first is ensuring that life-saving resources are not allocated based upon ageist stereotypes and biases. The second is that implementing safe and accessible services to help older adults maintain optimal physical and mental health is a priority during this time. An overall review of the article, these directions for future calls to actions are not judgments with substantiated value. I didn't find many errors within the facts of the article, and even if there were errors amongst the facts, it still does not detract significantly from the content of the material, as there's much evidence of how the pandemic affects older individuals that we can look at now within society and as we go forward into the future and prepare for other things that may happen. So I'm glad to share with you today a little bit about how I felt about the article and its implications for the field of aging, and I hope that we can learn more together. Thank you so much.